Hello there, Dr. Dicken Weatherby here from Optimal DX. Thank you for tuning in to a new type of video that we're going to be doing here. What I'm going to do is we write a lot of blog posts, a lot of content data over at optimaldx.com around blood biomarkers, optimal ranges, health, wellness, anything that we feel is appropriate for helping you to get your patients back into optimal health, or if you're a patient, getting yourself back into optimal health. And today I wanted to talk about a blog post that we posted a while ago. And it's around this concept of modifying our health behaviors to reduce chronic disease risk. So I wanted to show some insights from Optimal DX and to bring this to your awareness. This blog post is over at optimaldx.com. And I'll post the link somewhere on this video so that you can go ahead and get it. The topic of this blog post was written about this article, and this was an article written by Lewis and others in the magazine Cureus, and came out on August 26, 2020. And we looked at it and we thought it was pretty impressive. And it's called The Reduction in Chronic Disease Risk and Burden in a 70 individual cohort through modification of health behaviors. So let's go on over to optimaldx.com and we'll take a little look through some of our thoughts and insights into why we think that this particular article is very meaningful. So just give some background here. So diet, lifestyle specific health behaviors interact in various ways and can create health or disease. We all know about this, right? So we either, at any moment, we can make a choice as to whether or not we want to pursue health or maybe indulge ourselves a little bit too much and potentially push ourselves in a direction that we may not want to go in. Here are some facts that came from this article. I think these are facts that are really important for us to pay attention to. So first, number one, according to the Centers of Disease Control and Prevention, chronic disease accounts for 90% of healthcare costs, morbidity, and mortality. On average, residents of the United States with 5 or more chronic conditions spend 14 times more on health services than people with no chronic conditions. As of 2014, 60% of US adults had at least one chronic condition, 60%, and 42% had more than one chronic condition. Pandemics exemplified by COVID-2 show that people in good health suffer mortality rates at 10% the rate compared to those with pre-existing chronic conditions. Healthcare costs and morbidity rates often parallel mortality rates. A major impediment to health improvement is low health literacy. Part of our job as practitioners is to coach and instruct and help our patients become more knowledgeable and more self-reliant in terms of what they can do to take more control over their health. The World Health Organization reported that in 2010, non-communicable chronic diseases included cardiovascular disease, diabetes, cancer, chronic respiratory diseases accounted for 2/3 of the deaths worldwide. So, major causes of chronic disease occur with modifiable risk factors. In fact, we did a whole podcast on this. If you want to go look at Optimal, the podcast, we did a whole podcast on modifiable risk factors. So what are the modifiable risk factors? Well, these are things that you have a choice over. So you have a choice over to what you put inside your body. So unhealthy diet is a modifiable risk factor for chronic disease. Physical inactivity, tobacco use, alcohol use, that sort of thing. The World Health Organization stated, quote, "These causes are expressed through the intermediate risk factors of increased blood pressure, increased blood glucose levels, abnormal blood lipids, overweight, and obesity." So the major modifiable risk factors in conjunction with the non-modifiable, so we have these non-modifiable risk factors, right? What are those? Age, one's genetic, so hereditary. And one could say actually that with epigenetics, we do have a control over whether certain genes are turned on or off or more likely to express themselves. So these non-modifiable risk factors help explain the majority of new events of health disease, stroke, chronic respiratory diseases, and some important cancers. So the relationships between these modifiable risk factors and the main chronic disease are similar in many, many regions of the world. And dietary factors alone are associated with nearly half of all cardiometabolic deaths. Pretty impactful. So let's get to the study that I put up in that slide previously. So this was the study called, let me just get that back again, bear with me, Reduction in Chronic Disease Risk and Burden in 70 Individual Cohort through the Modification of Health Behaviours. So this study demonstrated that intensive individualized health coaching and medical guidance could significantly improve disease-based biomarkers and dramatically improve health. So let's talk about the study. In the study, personalized health plans were developed for 70 individuals as part of a 9-month disease reversal and prevention program. The study looked at individual health parameters as well as, because I'm very interested in functional blood, serum biomarkers known to reflect the presence and progression of chronic disease. So let's take a look at what biomarkers they were tracking. So they were tracking hemoglobin A1C and glucose, both blood glucose regulation markers, the neutrophil lymphocyte ratio, so the ratio between the absolute count of neutrophils and lymphocytes. And then we also have hsCRP, inflammatory marker, insulin, again, another marker of metabolic dysfunction, insulin resistance, blood sugar dysregulation, HDL, triglycerides, some of the main blood fats, vitamin D, self-explanatory, uric acid, inflammatory biomarker, white blood cell count, RDW, or the red blood cell distribution width, what is the size of those red blood cells, neutrophils, ESR, another inflammatory biomarker, fibrinogen, homocysteine, and this thing called the atherogenic index of plasma, which is actually a much more modified HDL to triglyceride ratio and more impactful. So many of the biomarkers improved were highly statistically significant. So we got actually a mean improvement in biomarkers across this 70 cohort individual study. So let's take a look at what those are. So the first biomarker they were looking at is actually an aggregated score called the chronic disease temperature score. I'm just going to, it is down below in the article here, but I'm just going to read this if I can find where it talks about this thing. So the CDT is a chronic disease temperature biomarker score as a relative value with 98.6 considered optimal and elevated values indicating chronic disease risk. So you can see their mean before was 102, mean after was 100.8, so they had a mean difference of 1.28, so that was a positive improvement. They saw positive improvements in hemoglobin A1C, aggregated scores, 5.87 down to 5.17. Glucose from 104, which would put it above the normal, to 95.1. Not necessarily optimal, but definitely moving in the right direction. NLR dropped, hsCRP dropped, insulin levels dropped, HDL went up, which is what you want. Triglycerides came down, vitamin D scores went up. Uric acid levels hovered around the same. White blood cell counts came down a little bit. RDW came down. Absolute neutrophils went down. ESR went down, fibrinogen went down, homocysteine went up, interestingly enough, and I'm wondering if that has to do with the fact they may have not taken into consideration someone's methylation risks. Also the type of vitamin B12 and folate, or B6, those people were taking, so that may have had an impact on why that homocysteine didn't go up. And then the atherogenic index of plasma went down, and overall their CDA risk score came down. So let's take a look at some of the studies, and this was some of the most impactful things that I saw. So case study number 1 was changes in severe psoriatic arthritis or psoriasis. So this was a photograph of before, and this is what they were like 5 months after the changes that were made, the health modifications. So normally in the case of autoimmune diseases like psoriasis, food sensitivities or allergies must be addressed. However, this participant was unwilling to eliminate some of the common allergens like gluten and dairy. And even then, she showed significant improvements. She was placed on a modest supplement regimen based on nutritional deficiencies determined from food journaling. So she was on cod liver oil, increasing those EFAs, vitamin D3, and a multivitamin mineral supplement. Again, we don't know the types of supplements that they were on. Was it a good form of those nutrients? Like I said, for the homocysteine, maybe it wasn't a methylated form, and other general supplements. Positive changes in lab values that they saw, their 25-hydroxyvitamin D status went from 24, which is fairly insufficient to 55. White blood cell count came down, RDW came down, fibrinogen came down. So it's hard to know exactly what they were doing, but significantly enough that they reduced their psoriasis from this to this. Pretty powerful. The second and the final case, if you want to go over to the article, there's a lot more in here, but this is another one I thought was absolutely fascinating, was a case of a severe rheumatoid arthritis. Here's a photograph of what his hands were like before, and this is what they were like 5 months afterwards. Again, this participant presented with major complaints, including a history of cancer, poor oral hygiene, high carbohydrate intake, high fructose diet, low fat diet, previous history of tick bites, low vitamin D status, rheumatoid arthritis, severe chronic back and joint pain, type 2 diabetes, and he refused pharmaceutical drugs per his choice. In addition, he almost never participated in traditional healthcare visits. He decided to participate in the HRP, but was considering adalimumab because of the constant pain. This is a very common drug for rheumatoid arthritis, pending the outcome of the HRP. The health revival process included supplements to match identified deficiencies and semi-monthly 45-minute coaching sessions. So over the first 5 months, the participant lost 25 pounds through a reduction in carbohydrate consumption, but with no significant change in daily calorie intake. Fascinating. So the participant embarked on a substitution diet where over 5 months, gluten-containing foods were removed from his diet, replaced with vegetables and marine and animal-based fats. He was also put on the following supplements: cod liver oil, vitamin D, magnesium glycinate, vitamin K2, and a multivitamin mineral. Here's the findings. His type 2 diabetes was reversed, as illustrated by his HbA1c dropping from 8.8 to 5.4, and his fasting glucose dropping from 180 to below 90. In 5 months. Pain was substantially eliminated based on a subjective pain score of 8 to 10 initially, 0 to 10. His rheumatoid arthritis improved to enable him to be able to bend his fingers into a full fist for the first time in over 5 years. Pretty darn impactful. So I know that there's a lot going on here, a lot to unpack, but the bottom line here is optimal health and wellness are achievable with the right motivation, the right guidance, the right perseverance. Health coaching, personalized lifestyle intervention can play a very major role in one's journey to optimal health. So if you want to go and read this blog post, please go over to optimaldx.com, look at our resources, and this one is in the Optimal blog, and you can check this one out here. One of the other things that we did do, and I want to show some of this right now, is that we actually put in some of the blood biomarkers into the software, into the ODX software. So I want to see, and I want to show you right now what the changes were that were happening in the blood biomarkers. So I'll be right back with that particular report. All right, so here we have a functional health report that was generated using the blood biomarker values from this report here. So this was from the Lewis chronic disease mean values. Okay, so let's go take a look and see what we can see. So blood test results, we can see the current values. What I want to do is actually go look at the comparative, and we can see what happened. So we can see here that fasting glucose, we saw significant improvement. Hemoglobin A1C optimized, EAG optimized. Fasting insulin came down even though it was still above optimal, moving in the right direction. The HOMA scores that were kind of interesting, obviously these weren't part of the program, but the HOMA2 insulin resistance score went from 1.42, which is above optimal, down to 0.93, and the sensitivity improved to 106.8. There was a little shift here in the percent output of the beta cells, but nothing too problematic. Still, the triglyceride glucose index was still too high. We like to see that below 4.4. And then the quickie also moved up in the right direction from 0.33 to 0.35. The uric acid was pretty much optimal both before and after. We saw an improvement in the lipids here in triglycerides, HDL cholesterol, and then the triglyceride HDL ratio was greatly elevated and normalized. Homocysteine went up, which we talked about a little bit before. but we saw improvements in all of these other biomarkers of inflammation, vitamin D status, RDW, and the total white blood cell count went and improved as well. So pretty amazing improvement here, and that's what I love about this comparative report at ODX, is that you can quickly see how things are changing over time. So if you're interested in that type of reporting, if you're interested to learn more about what we do at OptimalDX, please come on over to optimaldx.com. We are a platform that analyzes and interprets blood test results. We produce a functional health report. You can then take that functional health report and create what we call health concern-based treatment plans. It isn't just about giving a patient vitamin D. We actually tie that into the blood test result itself so that the patient's compliance goes up because they now know exactly why you're making the recommendation for the treatments that you are. We've got protocol template generators. We are fully integrated with Fullscript here in the United States and Canada so that you can go seamlessly from a blood test all the way through to a completed Fullscript treatment plan. So come on over, check us out, give us a try. We have very easy base memberships, $20 a month, allows you to operate on a pay-as-you-go basis. You buy credits and you put your blood test results in, and then you can generate all these incredible reports, just like the one that we saw a few moments ago. Anyway, my name is Dr. Dicken Weatherby. Thanks for watching, and we'll see you in another one.